This is Emotional Disturbance Disorders and Education by Samantha Foley. So, first of all, emotional disturbance, the definition of it is that it is a broad category that encompasses children with social and emotional disabilities. So, that's selective mutism, that can be bipolar disorder, it can be many different sorts, schizophrenia. So these disturbances, though, they must meet not only this criteria, but they must be persistent and affect the child's ability to learn. So it's not enough that they have a disability, it must affect their ability to learn. The five characteristics, according to Cullinan et al., is an inability to learn that cannot be explained by something else. So it can't be an intellectual disability, sensory issue, it can't be due to a brain injury, those sort of things. An inability to build and keep satisfactory relationships with both peers and teacher. Inappropriate types of behavior or feelings under normal circumstances. So that's like overreacting or even underreacting to things in a way that is not typical for their age. So there's a difference, for example, in a 3-year-old throwing a fit because someone has taken something from them, and a 15-year-old. Chronic unhappiness or depression can also be a factor. Tendency to develop physical symptoms or fears associated with personal or school problems. So that's when you get things like anxiety disorders, OCD, all those sort of things. So the different challenges are generally both social and academic. So even though this is a broad category, there are some common social issues, such as acting younger than they are, anger, isolating themselves, depression is very common, and to a lesser extent, selective mutism. Academically speaking, the majority of the studies that are done on emotional disturbances are either done on children who are in those separate special education classes or in specialized schools. So there isn't a lot of research on children who are, say, on monitor or are mostly in general education rooms. However, there is some common academic issues like an inability to focus due to things like anxiety, not due to things like can't see the board or other things like that. Improper social skills that you would need to work in groups or to do your work. Memory and cognition skills that are not brain related. And when I say that, I mean that are not related to like a brain injury. Lack of proper support. Due to the broadness of this category, you really have to tailor it to the child, and no two cases are truly alike. So prevalence wise, 12% of students have a moderate or severe emotional disturbance. Many of the data that you see, though, are estimations where they use brief surveys and then they use probability. And most of those actually underrepresent the numbers. The reason they do this is because the larger studies are very expensive. Children with emotional disturbances do often go undiagnosed due to a lack of understanding of child development. So what that means is sometimes an emotional disturbance disorder gets classified as normal behavior for a child of that age, even if it isn't. Demographically speaking, 34.4% of elementary and middle school children are classified with emotional disturbance, that are classified with emotional disturbance, and 38.1% of high school ones live in single parent households. Emotional disturbance disorders are higher amongst minorities and ELL students, especially the ones in the moderate and severe categories. More than three-fourths of them who are recognized and diagnosed are boys. And Wagner suggested that could be because teachers are looking more for the outward characteristics than the inward. And a lot of emotional issues are more outward for boys, but they're more inward for girls, like overthinking versus acting out. African Americans do tend to be one of the highest demographics, and low income schools, so they do differ greatly in the supports that they need from other schools. So they may need more behavioral based therapy, whereas non low income schools may need a different kind of therapy. However, Sipperstein found that little difference is actually found in their academic achievement. So, not depending on the type of school, these type of children generally do perform lower. And that's not dependent on the income level of the school. Medical treatments, there is cognitive and behavioral therapies are your most common ones. That's helping students connect their thoughts to actions, really think about what they're doing. Inpatient therapy is not super common, especially with the younger students. It does get more common as you get older, but it is most common in bipolar disorder. Long-term care, and by that we mean things like medication, ongoing therapy, or even lifelong therapy, things like that, is often needed. Educational strategy-wise, though, the biggest one is embedding behavioral supports into all learning areas. So that's like your reflection guides. Do I know what this is asking me? Did I stay on topic? Did I participate in the group? Partner supports, such as partner reading, is actually highly effective because it gives them that one-on-one. They also suggest that regular self-monitoring, even just on little cards or forms that align with a specific area of focus, like did I stay on task at certain times of the day? Have I used my behavioral support? Did I need to use my headphones? Those sorts of things. And then they also suggest that one-on-one time for targeted supports doesn't just need to happen between a para and a student, or even a student and a student, but there needs to be teacher-student one-on-one so that they can learn to build those relationships with adults as well. This is all of the references that I used, and thank you very much.